Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
On today's program, what I want to talk about is what is the main ingredient for success? If we're looking at a spinal injury practice today, what is the main ingredient for success? And, in my experience, I have a definite idea, a definite feeling of what kind of separates those providers that are really successful in treatment, successful in setting up their clinics, successful in developing interprofessional relationships, successful in being able to go out and get referrals, successful in being able to go out and get referrals from medical doctors or from lawyers, successful in being able to develop staff, successful. And it really comes down, in my experience, it comes down to one thing. And that one thing is the certainty level of the person who's actually creating. Remember, when you're creating your clinic, when you're creating your business, you are the creator of that business. You're the leader of that business. So your certainty of your product, your certainty of your services, the certainty of what you're doing, it actually permeates. It permeates your environment. It permeates your staff. It permeates your patients. It permeates all around you. And if there's areas of insecurity, if there's areas of lack of confidence. So, the confidence is really the state of feeling that really certain about something, the truth of something. So it's the feeling really certain of the truth of something, right? So in spinal injuries, if a person fractures their spine, nobody has any lack of confidence in that area that they don't have a fractured spine. Now, of course, you have to determine, what that fracture is or how bad the fracture is. But what I'm saying is a fracture is something that it has a great deal of certainty. There's not going to be any confusion with it. So, the other side of certainty is confusion. It's the state of not understanding exactly the truth of something, and you're unstable. You're on very unstable ground. So when you have this feeling of self-insurance arising from your own appreciation of your own ability, your own certainty, to me, it makes private practice a lot easier, and it makes private injury practice a lot easier. It makes it easier to, sort of roll out there and be good at whatever you want to be good at. So for me, it was the certainty of understanding that there were only 3 injuries to the spine. The certainty of understanding that you could have a fracture, that the spine only had 2 tissues to it. It basically has bone and connective tissue associated with it for the most part. And then if you damage the spine, you had to damage either the bone or the connective tissue. And that made things pretty simple. There's no lack of certainty there. And when you look at the soft tissue injury, there's 220 specialized ligaments. These are specialized soft tissues that hold the spine together. 23 of those are discs. That disc job is shock absorption. It's not necessarily stabilizing the spine. If you damage or herniate the disc, it doesn't necessarily cause excessive motion in the spine. If you damage the ligaments around the disc, the non-disc ligaments, that's going to cause excessive motion in the spine. So having the certainty that there's only 3 injuries and that these injuries are really easy to work up, they have completely different symptoms associated with them, they're treated differently, makes it very easy for you to have a foundation. When you understand that, you understand how to diagnose them, you understand how to work them up, how to image them. Look, you can't have a disc herniation without an MRI. You can't have excessive motion without an excessive motion test. And that's a simple X-ray test. Doctors that don't order an MRI are essentially saying that there's not a concern of disc herniation. Doctors that do not order an excessive motion test are basically saying to the whole world, there is not a high potential here of non-disc ligament injury damage. So when I have that kind of certainty on the injuries themselves, right? I say, hey, look, these injuries are treated differently. Well, a fracture they're treated differently. They're treated differently than a ligament injury is. depending on what the fracture is and how bad the fracture is. When you look at ligament injuries, there's two ligament injuries. There's disc herniation and excessive motion. Disc herniations are treated differently. If you look at the surgical aspect of it, they're treated with minimally invasive discectomies. Excessive motion from the non-disc ligament damage to that motion unit, those two units, two vertebrae that form a motion unit, that's treated with spinal fusion surgery. So you look at that and you say, okay, gosh, that's significantly different. If you look at the symptoms, a disc herniation in general is going to cause localized pain, and it's going to cause a potential radicular complaint, either pain or some other symptom of numbness, tingling into the extremity that's associated with that disc. So if it's cervical, obviously it's an upper. If it's lumbar, it's obviously a lower extremity. But if the patient shows up with any other symptom, remember, symptoms are how we determine what tissue or what thing to look at in the first place. So if we have a patient comes in and says, hey, look, doc, I got some tightening in my chest. When I go up 5 steps, I feel like I'm going to pass out. I get really dizzy, and my ankles have been swelling for the last month really badly. That doctor takes what that patient is having as a complaint, things that he's noticing that their body is different. Those are called symptoms. And you would go, okay, that's probably a heart condition and needs a heart workup. Now, if the heart came back normal, everything came back normal, then you got to search further. But you start with the easiest thing first. When a person has any other condition in a spinal injury other than localized pain and a radicular complaint, so if they have headaches, if they have dizziness, if they have vision problems, if they have breathing problems, if they have cognitive problems, if they also can have pain. They can have pain in the shoulder. They can have pain in the shoulder blades. They can have pain in other places than in the appendages itself. If they have any of these other symptoms, it's a symptom that there's more damage to that tissue than just a disc. Because remember, there's only 23 discs. There's a lot more other ligaments. So these other ligaments are significantly more problematic than just the disc. Look at the craniocervical junction. There's no disc there. So, a simple excessive motion of that area is going to show that you have a problem in that area. Now, when I understand the simplicity of that, and I understand that I have a feeling, a sense that what I'm communicating here is true, and I know that exactly what these conditions are, what the symptoms are that they treat, I look and say, here's what Medscape says is a disc herniation. Here's what Medscape says is general ligament damage. Here's the symptoms associated with general ligament damage. Here's the symptoms associated with a disc condition. And I look at it and say, wow, that makes sense. I improve my certainty. Now, when I can go out and take that certainty into attorney presentations or medical presentations or patient presentations, or I can take it into my patient communication, I can build it into my materials of having people understand these types of injuries, it significantly improves my confidence and it improves the confidence of everybody around me. So one of the nice things that I would say it's probably the most senior thing to expansion is certainty. Certainty of what you're doing, certainty in your ability, my ability as a provider to understand there's only 3 injuries. I know how to work them up. I know what to do to treat them. I know how my treatment affects them, stabilizes them, and helps to reduce down the long-term problems associated with this injury. I know how all of my modalities work. I know how my modalities are relating to these injuries and helping in the recovery of these injuries. I know my documentation is solid, and I can sit in depositions and I can explain this very simply and easily so that a 12-year-old kid can understand it. It's not hard. There's nothing hard with spinal injuries. They've been made way more complicated by providers and by professionals that really don't understand the simplicity of these injuries. When you get down to the simplicity of the injuries, it's really simple. And when you can take something that's complicated and make it simple, your certainty, your confidence skyrockets. And to me, that's the easiest thing to improve in a spinal injury practice today. Whether you're the lead doctor, the owner, or it's your associates, or you're an associate doctor. Male, female, doesn't matter. Doesn't matter what your specialty is. If you're dealing with spinal injuries, you have to know what these injuries are. You have to know how to objectify them, what imaging does that for you, how to clinically correlate that, and then what does all the consensus say around these injuries, and you're just presenting all of that. It makes for a very, very simple process. So all I do in these podcasts is take kind of a simple idea and just give you a kind of a riff on it. If you have any questions, you have any comments, put them down below. If you have any comments, give them to us at, you want to call in comments, give it to us at Smart Injury Doctors at 800-940-6513. If you have any interest in our program, contact us again at 800-940-6513. And as always, Doctor, I totally appreciate your time and your attention today on this podcast. I hope it gave you something to think about. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.